Hey all, this is our second video of oral surgery MCQs and picture based questions series. Hope you will be all helped from this video. Let's start. The first question is bleeding caused in a extraction socket due to wound sepsis after few days is called as option A primary hemorrhage, option B secondary hemorrhage, C reactionary hemorrhage, D systemic hemorrhage. So the key word here bleeding due to wound sepsis after few days. So what is it? Primary, secondary, reactionary or systemic? Answer is secondary hemorrhage. Now we have to know that what is primary, what is secondary and reactionary. So the discussion part. Primary hemorrhage, that hemorrhage at the time of injury or operation. Reactionary hemorrhage after 4 to 6 hours, or you can say within 24 hours if there is any hemorrhage. What are the causes of reactionary hemorrhage? Slipping of ligature, dislodgement of clot, cessation of reflex vasospasm, rise in blood pressure, restlessness. So here it is written within 4 to 6 hours, but other references also told that 24 hours, within 24 hours you can say that is reactionary hemorrhage. Now secondary hemorrhage, that is occurs in 7 to 14 days because of infection and clogging of vessel walls, usually artery. So if there are any infections or hemorrhage occurs after 7 to 14 days due to either infection or other causes, that is you can say it is secondary hemorrhage. So what are the predisposing factors? Pressure of a draining tube, the presence of a fragment of bone, a ligature in an infected area. So these are the explanation of first question. Now second question is very important. You often confused for identifying these two instruments blade. These two are blades of laryngoscope. You have to identify what are the names of these blades. One blade is straight, one is curved. What are the name of this curved blade and straight blade? The answer is the first one, that is straight, that is Miller blade used in Miller laryngoscope. Second, curved, it is Macintosh blade used in Macintosh laryngoscope. So the straight one is Miller and the curved one is Macintosh. This is very important MCQ. So straight one is Miller and curved one is Macintosh. Next, the antibiotic cover is mandatory before extraction in the following condition of the heart. Option A, prosthetic cardiac valves including transcatheter implanted prostheses and homografts. Option B, a history of infective endocarditis. Option C, a cardiac transplant with valve regurgitation due to a structurally abnormal valve. Option D, unrepaired cyanotic congenital heart disease including palliative shunts and conduits. And option E, all of the above. So what is the answer? I'll give you some time for think. I think you all know what is the answer. The answer is all of the above. These all are the indications for giving antibiotic prophylaxis. So let's discuss what are the answer is all of the above, and let's discuss what are the cardiac conditions when you have to give antibiotic prophylaxis before dental procedures, dental surgical procedures. This is the latest guideline by ADA 2021. Now what are the indications? Prosthetic cardiac valves including transcatheter implanted prostheses and homografts. Option B, sorry, not options, it is discussion. Prosthetic material used for cardiac valve repair, such as annuloplasty rings and chords. A history of infective endocarditis. A cardiac transplant with valve regurgitation due to a structurally abnormal valve. These are two separate points. A history of infective endocarditis, and next point, a cardiac transplant with valve regurgitation due to a structurally abnormal valve. Next point, the following congenital heart disease: unrepaired cyanotic congenital heart disease, including palliative shunts and conduits; any repaired congenital heart defect with residual shunts or valvular regurgitation at the site of a adjacent to the site of a prosthetic patch or a prosthetic device. So you can snapshot this particular slide so that you can read it later. Next, in case of Gow-Gates technique, the target area is, this is also a very important question. What is the target area of Gow-Gates technique? Neck of condyle, head of condyle, ramus of the mandible, maxillary tuberosity. The answer is neck of condyle. Now you can see in this picture the target area, neck of the condyle. This is the technique of giving Gow-Gates mandibular nerve block. So you can see the target area is neck of the condyle. Next question. In India, which preservative is most commonly used in local anesthesia? Option A, thymol. Option B, methyl hydroxyl benzoate. Option C, cetrimide. Option D, sodium paraben. I think you all know this answer. The answer is methyl hydroxy benzoate. Methyl hydroxy benzoate. I haven't make any separate slide highlighting the answer, but the answer is B. B is the answer, methyl hydroxyl benzoate. This was the last slide for today's small session. 5 important questions just for your practice. We'll meet you soon in the next video. Thank you very much.